Hi, this is Paul Spano from the World Congress of Hair Restoration, Bangkok 2019. I'm here with Eric from Eclipse, a Texas-based company, and we're going to talk about PRP. So, Eric, g'day. Yeah, it's g'day.
G'day.
Where do you think the most important time to use PRP in hair restoration is, or is there a lot of indications for it?
There's a lot of ways to use it. The doctors we work with, they use it for patients that maybe aren't quite ready for hair restoration surgery. One of the things that can happen, of course, is that you can cease to become a viable donor. I'm a great visual example of that.
Yes.
I do not have enough donor sites to cover this giant dome of mine.
Okay.
My big American head. So you want to be able to preserve, and you want to be able to maintain and stop the shedding, stop the hair loss, hopefully grow some new hair. So it's a great way to do that for patients that maybe aren't quite ready for hair restoration surgery. For the patients that are ready for it, it protects your investment. It also allows you to eliminate the dormant phase in the transplant. So the follicles that are transplanted often will fall out and then grow back.
Yeah.
This will eliminate that phase, but also
we're getting earlier growth.
Earlier growth.
Okay.
Yeah, exactly.
Yeah.
And then also somebody who is getting a transplant. It used to be people didn't realize like a transplant doesn't cure you of baldness.
Yes.
Your other hairs can still fall out, and so they would have to get multiple transplants. And the doctors, obviously love doing surgeries, but also they would like for a patient to be done once and be satisfied with the outcome. So
that's definitely my opinion. Absolutely.
So you do PRP. It keeps the hairs you have on your head. It helps them grow thicker and fuller.
I think you've made a great point that often is glossed over. Is that a hair transplant has got nothing to do with future hair loss.
There's no cure for baldness, unfortunately.
It's only repairing your past hair loss.
Yes, exactly.
So can PRP be used during the transplant, like at the beginning of the beginning of the day, at the end of the day, in the recipient area or the donor area? Where do you find it's used?
They will soak the follicles that they're using, the donor follicles, in PRP. PRP helps to strengthen follicles, and if it's living follicles, it will be able to work to strengthen them, keep them viable, and so you're able to implant those follicles and have them immediately use that PRP to start the growth cycle,
like a holding solution.
Exactly.
Yeah.
And then it really can be administered anytime during a hair transplant because it is a fairly non-invasive treatment. You can have it done that day.
Yep.
You can have it done a few days before, a few weeks before, and
what
then
about
continue
afterwards?
your regimen. Most of our doctors do an injection either the day of or before the surgery, and then they have a few follow-ups. So maybe three follow-ups after that.
I think
monthly
scientifically,
injections.
so when you put PRP into the skin, it activates growth factors, which then create new blood vessels.
Right.
And it's kind of like tilling the soil before you plant something. It's rejuvenating the skin,
we use
getting
that
it,
metaphor all the time.
You do.
You plant the seed, you water the seed.
That's right.
And if you have a laser phototherapy cap, you give it sunshine.
Yes.
And so this is
that's a great analogy.
It's a pretty good analogy because it's kind of the same concept. But with surgery, again, it's something where you release those growth factors. It's going to create what's called cell signaling, where it carries good information from a healthy follicle to an unhealthy follicle.
Yes.
So the good thing about hair transplants is you're implanting a bunch of healthy follicles, where you can then use their information to reawaken some of those other dormant follicles that are kind of headed on their way down.
Fantastic. That's fantastic. Thanks, Eric.
Yeah,
That's,
no problem.
some very good points there, and enjoy the rest of your conference.
Thanks so much. Have a great day, everybody.